We are here today to speak with Eva Matuszewski, the CEO of MedNetOne in Rochester, Michigan, for the first in a series of podcasts on the patient-centered medical home. Ms. Matuszewski is one of the state's leading experts on the patient-centered medical home, a timely and fast-growing development aimed at improving primary care and patient health. Let's get started. Eva, what is the patient-centered medical home?
The patient-centered medical home is a growing healthcare approach that establishes the primary care physician's office as the patient's medical home. The patient-centered medical home, also known as PCMH, is a concept, not a place, that puts the focus back on the patient as a whole person. The PCMH is gaining a sense of urgency nationwide as we see fewer physicians pursuing the specialty of primary care, while chronic illnesses that are best detected and treated at the primary care level are accelerating at alarming rates. Such illnesses include diabetes, asthma, heart disease, and obesity.
How is the patient-centered medical home different from the relationship I currently have with my primary care physician? Will I have to pay more for a medical home?
First, the patient-centered medical home does not cost the patient more money. The focus of the PCMH is on strengthening the core relationship between the physician and the patient. The physician in the PCMH coordinates his or her patient's care for outside medical services to a much greater degree than most primary care physicians currently do. When the patient requires the care of a specialist or specialty services, such as detailed medical tests or medical education, like diabetes self-management, the physician tracks and coordinates all of those services. This relieves the patient of the coordination of care burden and ensures that the primary care physician is closely monitoring all of her patient's medical issues, tests, and treatment. The PCMH also promotes group treatment visits when appropriate. For example, patients with type 2 diabetes may meet once a month as a group at the physician's office, their medical home, to obtain support and ideas for managing their diabetes. Also, allied health services such as nutrition, exercise, and mental health counseling or lifestyle counseling are frequently available to the patient at the physician's office and are coordinated to take place during the patient's regularly scheduled visit. This assures that the patient gets the services he needs when he needs it, as opposed to scheduling multiple follow-up visits at a hospital or different medical site.
There's a lot of talk about healthcare costs spiraling out of control. Was the patient-centered medical home designed to combat rising healthcare costs?
Well, yes and no. While the PCMH was not designed as a cost-cutting measure per se, it is anticipated that strengthening the patient-primary care physician relationship will keep patients healthier. This will ultimately reduce healthcare costs, largely through better control of detection and treatment of chronic illnesses such as diabetes, that in the long run are huge financial drains on the healthcare system.
Is the patient-centered medical home only in Michigan?
The patient-centered medical home has been making inroads in Michigan throughout 2008. However, it began at the national level with a Washington, D.C.-based initiative that attracted medical associations, academics, healthcare executives, Fortune 500 employers, including some based in Michigan. The collective goal of these disparate groups is to improve patient care at the primary care level while offering support and direction for physicians in primary care. An excellent website to check out for more information on PCMH efforts at the national level is www.pcpcc.net or simply Google Patient-Centered Primary Care Collaborative.
Does the patient-centered medical home require government control or reporting?
Oh, there is absolutely no connection between the government and the PCMH. Although more legislators are getting educated on the health and cost benefits of the PCMH as they relate to existing government insurance programs such as Medicare and Medicaid. As a matter of fact, the government is currently looking for 8 states to serve as host sites for a PCMH demonstration project for Medicare.
How do I find a primary care physician in my area that follows the patient-centered medical home philosophy?
Well, I would really recommend that you get to our website, www.mednetone.com, and simply take a look and see what names of physicians are available, since most of them are going through the process of becoming patient-centered medical homes. They are in various stages of transformation, and I would highly recommend that you just call and inquire as to where they are in their stage of change.